Okay, thank you everyone. How we're going to do this, now that everyone has introduced themselves, I've actually had a few pre-submitted questions. So I'm going to present a question to specific panelists, and they're going to answer it and kind of knock it back and forth between them. And then see how that goes, and then we'll take questions from the audience. So right away, I'm just going to go to the meat and bones, the question I received. Dr. Groves, I'm going to point this one towards you since you have such variety. What are some pros and cons of the current healthcare system in your opinion?
I can only think of one good pro, and that is our dedicated providers. Whether we're talking about physicians or nurses, nurse assistants, medical assistants, our ward clerks, even our food service workers and our janitors in our facilities. Everyone I know in healthcare is dedicated to patient care. And that is huge, and you can't incentivize that. You can't even pay for it. You get it for free. And I don't see that changing into the future. I think healthcare attracts people who want to help people regardless of the circumstances. But I have to tell you, pretty much everything else about the practice of medicine these days is a con. So you have to have that kind of dedication. You have the burden of our broken healthcare system placed on your shoulders day after day and still do it. And some of you may have personal experience with people getting out of the medical profession, whether they're nursing providers or physicians. And there are plenty of stories from my colleagues and myself about family members. You know, traditionally your family at least gets a pretty good look at how medicine is from your lifestyle. So many of my peers, their children, their relatives have no interest in going into medicine these days because they've seen just how difficult it is to be a provider. The cons are too numerous to mention, but they include lack of access, lack of quality of care, and the increasing cost we're paying for this lack of access and substandard quality.
Okay, I agree with Dr. Groves. It's a lot of good things about the physicians and their dedication, but it is very difficult for a physician practice to want to stay open and to perform the medical treatment that they have learned and been taught. Just from experience out of the 6 doctors we have one doctor that simply just wants to treat his patients and would accept chickens for fee. But you can't do that because you need to fund your practice. It's very difficult for the one particular doctor to keep up with the electronic requirements, the documentation that's necessary. So it's easy to see how one could be discouraged in being a physician.
I would just like to third that just at Osterlin, I can't tell you that what I've come away with most is just how dedicated the staff are. They make very little money, and most of them have worked there for years, and yet they go out of their way every time for clients who have very difficult situations, very severe mental illness, and that's been impressive. And that's on top of the paperwork and then all the cons that they face on a daily basis. So it really is amazing how dedicated healthcare professionals are.
Yeah, I've seen the same thing. Rocky Horse Center is a nonprofit, and the context of that, our revenue streams are basically 2. One, revenue for patients, and that includes some with insurance, a lot of Medicaid. About 60% of our patients have been Medicaid, and there are some self-pay patients. We provide universal access. We treat and take care of anybody, regardless of the ability to pay. We've got some patients who have great insurance, but the vast majority of our patients are struggling, have maybe poor insurance, and by that I mean insurance with really high deductibles, high co-pays. So they're reluctant to use their insurance as a result of that because they realize it's going to be coming out of their pocket, and their pocket is not very deep. And then the vast majority of our patients who are on Medicaid is a challenge for Rocking Horse Center, has been historically, because it costs on average about $100, $120 to see a patient at Rocking Horse Center, and Medicaid historically up until just recently, and I'll talk about that in a minute, reimbursed us about $35. So $35 costs us $120. You can see that that's a losing proposition pretty fast, right? And so the folks who work there, have gone through some very difficult times in terms of funding. Their wages are pretty kind of a little bit lower than the market in some instances. We try to keep up with the markets. We attract good people. We do have dedicated people there. But recently we have become what's called a federally qualified healthcare center. And as a result of that status, this is wonderful news for Springfield and Clark County. We are able to receive several benefits as a result of this new status. Number one, we get enhanced reimbursement as a result of being an FQHC. And that the reimbursement level is on a cost basis. So it costs us $120 to see a patient. We basically get $120 reimbursed for Medicaid, which is fabulous. So you can see from $35 to $120, that's additional revenue flowing in that we can use to plow right back into seeing patients. And the need in this community is tremendous in terms of the number of folks who are struggling to get access to health care. If you try to get access to a primary doc in this community, it's very, very difficult, isn't it? You cannot get in. And that's because we're HIPSA, we're a healthcare provider shortage area in this community. We don't have enough primary docs. We also don't have enough dentists. We're dental HIPSA. As an FQHC, we've got to provide dental services, so we're going to be getting into that as well. We have to provide OB services, and we're going to be doing that as well. So one of the major benefits is the enhanced reimbursement. Another major benefit is we get Federal Tort Claims Act protection for our providers, which means the federal government will cover malpractice for us. Malpractice is a huge expense, and you ask any doc, and they'll tell you it's the cost of malpractice has been skyrocketing, and in some subspecialties it's just ridiculous, and they're just going out of practice because they can't afford malpractice. Particularly OB-GYNs, for example, very, very expensive to get malpractice insurance coverage. Now that we have federal tort claims protection, we'll be able to essentially reduce our malpractice costs over time to zero. We have to pay what are called tails. So if a doc leaves, or if we start covering with FTHCA coverage, we have to pay a tail for prior to that coverage period. So it will be some expense, but it's a huge boon to us into the future. The other advantage is we have access to grant programs that we didn't have access to now that we're in FQHC. And we also get, on an annual basis, at least $600,000 to pay for uninsured. And let me tell you, the community health centers that are around the country, which Rocking Horse Center is now, are really have been plugging the gap in terms of the people that have been falling through the safety net in this country for a long, long time, going back to the 1960s when this whole program was established. And every president has had since Johnson, Nixon, Ford, Carter, Reagan, Clinton, Bush II, and now Obama, every one of them has supported community health centers, the expansion of community health centers in this country, because they understand on a bipartisan basis the importance of making sure that there is that access to people who are struggling to find health care. And this community has been named one, and it's a real jewel in this community. And I would say that the staff there have really seen some difficult times as we try to struggle, but this has been a real boon to our efforts to try to expand care.